Okay, so focusing on the hamstring, we're going to talk about proximal and distal portions of the hamstring. Proximal would be, the proximal hamstring is the hamstring focusing more towards the glute. The distal hamstring would be closer to the knee, okay? Now, one of the things that surprised me, and there's a research study I was looking into, is that if a tear in the hamstring was to happen higher in the glute, right? So up here is different than a tear in the belly of the hamstring, which is here. Because a tear in the belly of the hamstring has more muscle around it, so the recovery time might be faster than a recovery time with the hamstring issue all the way to the top of the hamstring. Why? Because think about the insertion. This is where the hamstring attaches to the bone. So a lot of times in an attachment, the muscle has a tendon, and that tendon sometimes isn't full muscle. The tendon is covered by other layers of sheets of connective tissue that might sometimes be a little bit avascular, meaning that it doesn't have a lot of blood supply and blood support, and that causes sometimes to not have the healing process that you would have the same as in the belly of the hamstring, opposed to something that's more proximal to the glute. So just something to put out there, because I think that a lot of times when we're talking about hamstring injuries, a lot of people are like, you'll see like in a track meet, if somebody's running and they pull their hamstring, they're grabbing their glute, you know it's a proximal hamstring injury. And if they go do something that's more subtle and it's lower in the hamstring, it can tell you in difference in what you need to do, okay? Now let's talk about hamstring. He's gonna bring his leg straight up, just like this, toes up, okay? He's gonna bring one leg, okay? We're gonna go the right leg all the way up, go as far as you can go, okay? You see that little shakiness? That means as much as he can go. This angle is as much as he can go. He's gonna relax. We're gonna help him increase his range of motion. So what we're gonna do is go up again. What I'm gonna do is I'm gonna come here, okay? I'm gonna allow him to bend his knee slightly, and he's gonna put some tension down on my arm. Ready? Go. Just like that, he's putting some tension, okay? Keep going, there you go. So I'm just gonna show a little bit of your hamstring, focusing on the hamstring being contracted throughout that whole time, allowing his body and his muscle to understand that the tension here is not bad. We're not trying to stretch it, we're not trying to do anything, we're just trying to isometrically contract it. Relax. Okay, so now go a little bit higher. Can you bring it up a little bit higher? Okay, you feel a little bit more comfortable there? Ready? Go. Press down. Press down. There you go. Good job. Keep the tension there. Okay. I'm gonna keep this tension on the hamstring. I'm gonna keep going. Okay. Ready? Relax. Can you go a little bit further? Okay. You see, he's improving by himself, and all he's doing is contracting. Go. All he's doing is contracting. So this is something I like to do. And coaches, you'll notice that obviously right now I'm on a box, but if you were to be on a, you know, on a table or something, there's something great that you can use with your athletes. Ready? Relax. Okay, so what I like to do, I come here, put your leg straight, lock your knee. I like to use body mechanics for myself, and I don't like to put too much tension in, so I let him go as far as he can go. Ready? And press tension, go. Okay, relax. We're going little by little, we're going more range of motion. Ready? Go again. Go. 5, 4, 3, 2, 1. Okay. Okay, he's good, he's good. Okay, relax. Now give me a little bit more tension. Go. 5, 4, 3, 2, 1, relax. That's as much as I'm gonna stretch him, because I can feel the tension in the hamstring, okay? Relax, put it here. Now, when you're stretching the hamstrings, a lot of times people will tell you, keep the knee straight, which I agree. You do need to keep the knee straight. But keeping the knee straight is gonna focus on the proximal side of the hamstring. Again, that's what we spoke about, having the tendon attachment, okay? So sometimes that area is really tight, And something that would be easier to get into is the middle of the hamstring, the belly of the hamstring. So I rather sometimes bend the knee a little bit, focusing on stretching it there, and also keeping the knee straight so we can focus on the distal part of the hamstring and the proximal side too. So we already did straight. We're gonna slightly bend it. Okay, now let me see as far as you can go. Now go, press down against me, but don't lock your knee. Go. Good. Keep going. Keep going. Keep going. Relax. You can see there's a difference just with stretching the distal side of the hamstring. Ready? Go. Relax. Okay, so now it's time to retest. Okay, bring that leg straight up. Okay, point your toes up. Okay. You can see the difference from this angle and the previous angle that he had. Okay. Again, when we're talking about the hamstring, this is something that you can do with a partner, but you have to be very careful, because if you surpass or you do like this and you rely all the tension here, what happens if you slip and you go forward? This person now has the trust that they're giving you to put tension on their hamstrings. You might go slide forward. So you have to be very careful, guys. Don't allow yourself to get comfortable, be on your phones, or do something like this that can hurt somebody. So always be very cautious and make sure there's communication between you and the person you're stretching. Flexibility is a big thing. Relax. Flexibility is a big thing that sometimes you might not take in consideration when you're doing your training. Like what we just did, we focus on our ankle, we just focus on our lats. Let me talk about the creeper muscle. Let's talk about the muscle that nobody wants to pay attention to, and that's your psoas. I'll show you now. Come. Okay. I want him to get at the edge of this box. Okay, lay back. Okay, slide down more. Okay, so I'm gonna bring both of his feet up. Okay, so he's here. Okay, I'm gonna allow him to test where he's at. Okay, relax. So if you notice how his angle in his knee, this leg comes straight up. It doesn't even bend, okay? What is that telling me? That the quads are really tight. Something that would be more flexible would mean that his leg would be able to do this. But right now he has a really tight quad, or maybe a really tight hip flexor that might be causing the issue here. So it's up. How do we work on this? I'll show you now, okay? So what we're gonna do is I'm gonna slightly put some tension on this quad, okay? He's gonna come and press up, go against me. No, relax the leg, go up, okay? He's gonna press up, we're gonna hold it for 5 to 10 seconds. There you go, give me a little bit more tension. 5, 4, 3, 2, 1, relax. Okay, so I'm pressing down a little bit more. When you do this, you really want to be relaxed, especially when you're stretching. And I know sometimes it might be a little bit tough because you're doing this and your body wants to react. You want to change to where something feels more comfortable, but you got to trust the person that's doing this if they know what they're doing. If not, you have to be careful, okay? Now, ready? Go, bring it up. Go, 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 go. Relax, okay? So what I like to do, I like to ask, where do you feel that more?
Right on my hip flexor.
He feels it more in his hip flexor. And that makes sense because when I'm pressing down, notice that there's no tension on the foot. I'm not doing anything with the foot, so he's gonna feel it in his hip flexor, okay? So now I'm gonna relax. Okay, relax your foot. Okay, bring it back down. Okay, as you can see, maybe he might be a little bit more down, but let's try to work on keeping his knee more down. As you can even see, his foot is more down, okay? So now I'm gonna come, and I'm gonna try to get his quads to stretch. Ready? Press against me, okay? Press against my foot. Go, 5, 4, 3, 2, 1, relax, okay? This is a deeper stretch. This is what you wanna do after. This is usually seen in a PT clinic or somebody in the athletic training room. You'll see more of these kind of stretches. I like to do them every now and then with members or clients that really need the focus that they need to work on their flexibility, okay? Ready? Let's go at same thing. Ready? Go against my hand, against my foot. 5, 4, 3, 2, 1. Relax. There you go. So he's stretching a lot more, okay? He's definitely stretching a lot more. I'm just keeping the tension. I'm not pushing more than what he needs to. Okay. Ready? And last one. Go. Push against my leg. Go. Push, push, push. There you go. Keep pushing. Making that quad work actively. Okay. Relax. Okay. This is the deepest stretch we've had yet so far. Okay. So now he's gonna relax. Maybe let's retest again. Go all the way up. Let's bring it down. Relax. Do you see the difference of now and how he had before? Okay. So you see more flexion, more degrees of flexion at his knee, and his femur is more aligned to his hip.